If you have a bulge in your body, get it checked immediately. Do you have a hernia? 7 warning signs you shouldn't ignore. A hernia happens when an organ or tissue pushes through a weak spot in the muscle or connective tissue. This can occur in areas like the groin, abdomen, or near the navel. Let's explore the 7 warning signs you shouldn't ignore. Let's start with the most common sign. A visible bulge. You might notice a lump or bulge in the affected area, which becomes more obvious when you're standing up, coughing, or straining. Initially, this bulge might start small and painless. It could be as tiny as a pea or as large as a grapefruit. Over time, this bulge can grow larger and become more noticeable. As it enlarges, you might start feeling uncomfortable or even embarrassed, especially if it's in a visible location. This bulge is essentially the organ or tissue pushing through that weak spot, and it's trying to signal to you that something is not quite right inside your body. Next, let's talk about pain or discomfort. This can be one of the more distressing symptoms. You might feel a sharp pain or a dull ache, particularly when lifting, bending over, or coughing. Imagine the sensation of lifting a heavy box and suddenly feeling a sharp twinge in your abdomen. This pain can be persistent or come and go. Sometimes it feels like a constant dull ache that never fully goes away. This pain often gets worse after physical activity or standing for long periods. It's your body's way of telling you that the muscles and tissues are under strain and need attention. If you're liking this video, please subscribe to Wellness Wave and hit the notification bell so you don't miss any of our health tips. Now, let's move on to the burning or aching sensation at the site of the bulge. This sensation can feel like a constant irritation or a sharp, sudden pain. It's like having a small flame or a pin constantly poking you. This burning or aching can intensify with specific movements or activities, making everyday tasks feel like a chore. Simple actions like bending down to tie your shoes or reaching up to grab something from a shelf can trigger this discomfort, constantly reminding you that something is wrong. Another common sign is a sense of heaviness, weakness, or pressure in the abdomen or groin. This feeling can be accompanied by a dragging sensation or a feeling of fullness. Imagine feeling like you have a weight tied to your lower abdomen or groin, pulling you down. This sensation is especially noticeable after eating a large meal or during physical exertion. It can make you feel sluggish and tired, impacting your daily activities and overall quality of life. For hiatal hernias, changes in digestion are a significant symptom. These can include heartburn, difficulty swallowing, or regurgitation of stomach acid. These digestive issues can cause a lot of discomfort and might be mistaken for other stomach problems. If you have chronic heartburn or acid reflux that doesn't get better with standard treatments, it should be checked out for a possible hiatal hernia. These symptoms can disrupt your eating habits and sleep, leading to a cycle of discomfort and fatigue. Swelling and tenderness around the affected area are additional signs to watch out for. The swelling may be mild at first, but can become more pronounced over time. This area may feel tender or sensitive to the touch, making it uncomfortable to wear tight clothing or press against the area. The tenderness can feel like a bruise that doesn't heal, constantly reminding you of its presence. In severe cases, particularly with hiatal hernias, you might experience nausea and vomiting. These symptoms can indicate a more serious issue, such as a strangulated hernia, where the blood supply to the herniated tissue is cut off. This is a medical emergency and requires immediate attention. Nausea and vomiting can be alarming and debilitating, preventing you from keeping food down and leading to further complications like dehydration and malnutrition. Now let's discuss the diagnostic procedures used to identify hernias after recognizing these symptoms. If you suspect you have a hernia based on these signs, it's crucial to see a healthcare professional promptly. Your doctor will begin with a thorough physical examination. They will palpate the area where you feel the bulge or discomfort, checking for the presence and size of the hernia. In some cases, the bulge may be visible during the examination, especially if it appears when you cough or strain. Following the physical exam, your doctor may recommend imaging tests to confirm the diagnosis. Ultrasound is often used to visualize the hernia, as it can show the protrusion of organs or tissues through the weakened muscle or tissue. CT scans or MRIs may also be ordered, particularly for complex hernias or to assess for complications like strangulation. If a hiatal hernia is suspected, your doctor may perform additional tests such as an upper endoscopy or barium swallow. These tests can provide detailed images of the esophagus and stomach, helping to diagnose the presence and severity of the hiatal hernia. So, what should you do if you're experiencing any of these symptoms? First, it's crucial to see a healthcare professional. They can perform a physical exam and may use imaging tests like an ultrasound, CT scan, or MRI to confirm if you have a hernia and determine the best treatment options. Early diagnosis can prevent complications and provide peace of mind. Treatment for hernias usually involves surgery. There are several types of hernia repair surgeries, including open surgery, laparoscopic surgery, and robotic-assisted surgery. Each type of surgery has its own benefits and recovery times. Your doctor will recommend the best approach based on the type and severity of your hernia. Open surgery involves a larger incision and a longer recovery period, while laparoscopic and robotic-assisted surgeries are minimally invasive with shorter recovery times. In some cases, lifestyle changes can help manage hernia symptoms. Maintaining a healthy weight is crucial because excess body weight can put additional pressure on the abdominal muscles. Avoiding heavy lifting is also important, as it can strain the muscles further. Practicing good posture can reduce strain on the abdominal muscles, making them less likely to weaken. Eating smaller, more frequent meals can help manage symptoms of hiatal hernias. Avoiding foods that trigger heartburn, such as spicy or fatty foods, can also provide relief. It's also important to know the risk factors for developing hernias. Factors like chronic coughing, heavy lifting, obesity, and a family history of hernias can increase your risk. Being proactive about managing these risk factors can help prevent hernias from developing in the first place. If you have a job that requires heavy lifting, make sure to use proper lifting techniques. If you're overweight, adopting a healthy diet and exercise routine can reduce your risk. If you have a chronic cough, seek treatment to manage it effectively. If you have a hernia, there are several things you should avoid to prevent making it worse. First, avoid heavy lifting. Lifting heavy objects can put additional strain on the affected area and make the hernia worse. If you must lift something, use your legs and keep your back straight to minimize pressure on your abdomen. Second, avoid straining during bowel movements. Straining can increase pressure in your abdominal cavity and worsen the hernia. Eating a high-fiber diet and staying hydrated can help prevent constipation and straining. Third, avoid standing or sitting for long periods. Prolonged standing or sitting can increase pressure on the hernia. Try to take breaks and move around frequently to relieve pressure. Fourth, avoid wearing tight clothing. Tight clothing can press on the hernia and cause discomfort. Wear loose-fitting clothes to avoid adding extra pressure to the affected area. Lastly, avoid foods that can cause bloating and gas, such as beans, carbonated drinks, and certain vegetables like broccoli and cabbage. Bloating can increase pressure in your abdomen and exacerbate hernia symptoms. Thanks for watching. If you found this video helpful, please give it a thumbs up, subscribe to Wellness Wave, and hit the notification bell so you never miss any of our health tips. Stay vigilant, stay informed, and most importantly, stay healthy. See you next time.